Welcome back to my channel. How are you? I hope you're doing well. I hope all is well. My name is Anna K. Rule, and I'm a registered nurse. So I know I'm looking a little bit more casual today. I was doing some errands on the road. I just wanted to get this video out, so I'm like, let me just do it because I really want to talk about colon cancer, and I just wanted to make sure I get a video out on that topic. I'm also outside. It's a beautiful day, so I wanted to capture the moment, and that's what we're doing. We're outside, and it's just lovely. So I wanted to talk about colon cancer as I said before. The month of March is actually Colon Cancer Awareness Month. Colon cancer is the third leading cause of death in the United States, and deaths are highest among African American men as compared to all other ethnic groups. Colon cancer occurs when there's abnormal growth or tumor in the large intestine, which is also the colon, and the rectum. Now, the thing about colon cancer is that the risk factors include obesity, advanced age, and normally when we say advanced age for colon cancer, we mean greater than 50, a diet that is high in fat and processed meat, and that is low in fiber. Also, a heavy cigarette smoker and excessive alcohol use are among the risk factors. Family history is also a risk factor, a big one that increases the risk of any colon cancer. Let's go into the symptoms for colon cancer. The thing about colon cancer, the symptoms are so mild that it can, one, not be recognized, but also can be easily confused with other GI issues that one may be having. So take, for example, abdominal cramp or abdominal pain. Those are symptoms as well. A change in bowel movement and also bowel habits. So if you're a person that used to go to the bathroom or have bowel movement like every day, and now you find you're going every 2 to 3 days, and you didn't change anything in your diet, you didn't change anything, you didn't start eat differently, and this is happening. Also, a change in the consistency of your stool, meaning that the size of the stool has changed. And it's not like a one or isolated episode. This is like over weeks or a month or so, you know, so this change is going on. And also if you see blood in your stool. So I know sometimes we don't always look after we, conduct our business, but it's important to peek and see what's going on, especially when you know that something is odd about the movement or what led to you having that bowel movement. It's okay to look at it because when we ask patients, is there blood in your stool? Patient says no, they don't know. And you really wouldn't know unless the case where, like when you wiped, you saw something, or it's a case where you obviously noticed it. So it's important to look, take a peek, just to see what's happening around there. Now, the thing about it, how do we diagnose colon cancer? One of the things that we try to promote is early screening, because early screening leads to early detection. Screening that can be done, that's non-invasive, and that can be done every year as a part of your annual and your physical, is to get a fecal occult blood test done. Now, this is normally recommended for those over the age of 50, and a sample of your stool. So normally you get to take the container home and you return a sample of your stool, which is then sent to the lab, and then that is tested to see if there's any blood in the stool. Another way is the dreaded colonoscopy. And colonoscopy is when a camera is inserted through the rectum and it gives a better visual of what's going on inside the colon. That way, the provider can see if there's any polyps, any abnormal growth, anything that's happening inside the colon. Now, I know that a colonoscopy is dreaded by many, and it's understandable. You're going to have a device inserted into your rectum, and that can be very terrifying. So it's understandable. But the thing about it is that is one of the best diagnostic tests. Because let's say you have blood in the stool. Okay, that is recognized, there's blood in the stool. The next step now would then be due to colonoscopy, so that the colonoscopy could show if this blood is related to there being any cancer in the colon. And I know that's one of the reasons too why many people shun from getting a colonoscopy done, and then often many times when therefore be forced, or when it gets onto the point where one needs to be done, it is so late or advanced in the stage, rather than if we'd done it early as expected. It's something that probably could have been caught early. CT scan can also be done of the colon to see what's going on. An X-ray could be done, but with the X-ray, because they're going to be using a contrast, a barium contrast, the X-ray contrast will also be inserted through the rectum, and then that will illuminate the colon, so any abnormalities could be caught through the X-ray. Now, one of the things that I said for diagnostic tests is that most of the screening do start for someone over the age of 50. Now, I know probably many of us saw in the media Chadwick, that Chadwick Black Panther died last year of colon cancer. And it was very sad, death overall is very sad. He was 43 years old when he died. And that's one of the things, like you're saying, okay, if screening is 50, this is a young guy, and people are dying younger than 43 as well of colon cancer. And that's when it comes down to observing what's going on in your body, and also when it comes down to if you have a family history. So if there's a first generation family member who had colon cancer, it is recommended that you screen 10 years prior to that person being diagnosed. So let's say it was your mom or your dad who was diagnosed with colon cancer. If they were diagnosed at, let's say, age 45, for example, then your screening will be recommended to be started as early as age 35. And it's just so we can catch anything early, because when they were diagnosed at that age, it's most likely a case where there were significant changes that they noticed that would have caused them to have a colonoscopy or to have this diagnostic test done. So if a family history, first generation family history is known, then screening should start as early as 10 years prior to when that person was diagnosed. Once diagnosed, treatments could include radiation, chemotherapy, surgery, medications, but all these treatments depend really on how early or the stage at which the cancer is detected. So then it all comes down to early detection means early interventions, early treatment, and better outcomes or prognosis. So I really want to promote colon cancer. It's something that we have to encourage ourselves and those around us to do, especially when you get to the age where the screening is recommended. As it is, most time they're going to start with a non-invasive. They're going to start with the fecal occult blood test. When the colonoscopy is something that's done as well. If the colonoscopy is normal, that means that there are no polyps, no abnormalities. It's usually done every 10 years. So the dread experience is not something that's going to be done every month or every year. If though there are abnormalities or any abnormal findings, they may want to repeat, or may recommend to repeat at least every 5 years in that case, if there's any abnormalities. So it's not something that's done every year, but when done, it is very good in diagnosing colon cancer, and we have to just do the best we can to take care of ourselves. Alrighty, so thank you for watching. I hope you have a good week, and be well and stay safe.